Hi, it's Brian. We're going to do our medical assessment today. For medical, we're going to make sure we have our BSI penman, so body substance isolation. Penman is personal safety, partner safety, patient safety, public safety. E is for environmental hazards. N is for number of patients. M is for mechanism of injury or nature of illness. A is for additional resources. N is for need for extraction. So once we do that, we're going to arrive on scene, and once we arrive on scene, our patient is laying on the ground, calls for chest pain. So we arrive on scene and we're going to give our general impression. So our general impression would be male, age, weight, ethnicity, and then once we have our general impression, we are going to introduce yourself. So, hi, my name is Brian, I'm an EMT, and then I'm here to take care of you. And while you're doing that, you're also going to check for AFPU, which is alert, verbal, painful stimuli, or unresponsive. Once I introduced myself, they answered back, hi, how are you? So we know they're alert. So we're going to go ahead and continue on to their chief complaint. So we're going to ask them, why did you call us here? And then they're going to say, for chest pain. That was their chief complaint. And once we have their chief complaint, we're going to go ahead and assess their ABCs. So airway, breathing, circulation. For airway, we're going to go ahead and check, make sure it is open, clear, maintainable, suction. And from that, you're going to be able to determine the patient's, that the patient needs an airway adjunct, appropriate airway adjunct, or suctioning. For breathing, you're going to do their rate, depth, ease, SpO2, lung sounds, and then from that you're going to be able to tell if the patient needs oxygen therapy. So we'll just go ahead and grab the oxygen because he's having chest pain. So we'll go ahead and give him some oxygen with nasal cannula at 3 liters, which will give them about 24 to 44% oxygen. After that, we're going to go on to circulation. So they're going to do rate, rhythm, quality, any life-threatening hemorrhaging, skin color, or skin signs, which is color, moisture, temperature. We're also going to check for cap refill. So we're going to do all that after our ABCs. That will be your first load and go. If they're going to have anything wrong with them right there, if they're ABCs, it'll be a load and go. If not, then there'll be a stay and play. Either way, if they're a load and go or stay and play, you're going to move on to your PPTP, which is going to be person, place, time, purpose. So you're going to say, what is your name? They'll answer, where are we right now? Answer, time, what time is it? Answer, and then why did you call us today? Why are we here? And answer. And then you're going to move on to your OPQRST, which is onset, provocation, quality, radiation, severity, and time. And those are also the S in sample. So onset is, what were you doing when this happened? And then provocation is, so what makes this feel better? They would answer. And what makes this feel worse? Then you're going to ask them the quality. So can you describe the pain for me? Okay. And does the R for radiate, does it travel anywhere? Do you feel the pain elsewhere? Okay, and then severity, on a scale of 0 to 10, what would you rate the pain? Okay, and then T for time. So what time did you start feeling this pain? Okay, so that's all the S in sample, and then for A is for allergies. Do you have any allergies? M is for medication. Are you taking any medication right now? If they are, you're going to gather their medication and take them with you to the hospital. And then you're going to go on to P for past history. Have you ever had a history of chest pain, anything of that sort. Okay, and then they'll answer that, and then Al is your last oral intake, was the last thing you ate or drank. Okay, and then E is for our events proceeding, so what led up to your pain, what events were you doing before this. Okay, so then after sample, you're going to go ahead and focus on the chief complaint, your inspect, and while you're inspecting their chief complaint, you're going to go ahead and grab a set of vitals, which would include blood pressure. You'll check pupils for a pearl, pulse, respirations, blood glucose, and skin signs, I believe. And after that, you're gonna go ahead and do fit, which would be your field impression. So chest pain, and then depending on whatever they would say, could be MI, heartburn, anything what you would ask to find out, give your field impression. Then you would go for I as intervention, which would be your medication, which you think would wrong, depending on if it was a MI. The ALS provider would go ahead and give them nitroglycerin, would be administered, and you have to also remember your rights and diced, your 5 rights or diced. And then T would be for transport if the patient wasn't already in transport. So since the patient is stable, you're going to go ahead and reassess the vitals. Your ongoing assessment will be every 15 minutes. And for that, you're going to check for make sure every 15 minutes their ABCs, vitals, AFPU, ABC, vitals, AFPU, and ABC, vitals, AFPU, and PQRST. And that would be it.